healthcare business podcast from the Coker Group that focuses on solutions to help healthcare organizations effectively navigate the changing healthcare industry landscape.
All right, welcome to another episode of Coffee with Coker. Today, we are talking with a panel, some of my colleagues from Coker, Richard Romero, we have Brandt Jewell and Alex Kirkland and myself, and we are talking about telehealth, and specifically, we are talking about some of our initial general observations and takeaways from a survey that we did amongst our clients who are from hospitals, health systems, and medical practices, and collecting information on what they are currently doing, where they're at kind of on the ground and implementing, adopting, and utilizing telehealth. And I go into more detail about the survey itself in the discussion, but basically, and as we're still in the midst of quarantining and social distancing, we're doing this over Zoom call like everything else seems to be these days. And so I do apologize if some of the audio may not be as optimal in places, but it's kind of the new normal that I think people are getting used to. But really what I wanted to do was just record us having a conversation really around some of our general observations on the survey responses. I thought it was extremely valuable and helpful to get this feedback from folks that are living, working with telehealth to varying degrees on the ground. It was a good discussion. We did cover kind of a general high level, so and that was intentional because the plan is to have follow-up information and content. We'll do podcast episodes as well as other content on some of the more specific, they're drilling into some of the more specific areas and interesting points that came about from the survey responses itself. So we will have follow-up information on all this, but this was just, I thought, a good discussion on general observations. Stay tuned for more information. And of course, as always, if you have questions, reach out to us, or if you need additional information on anything that we talked about or teed up here, we would love to hear from you. So thanks for listening. Enjoy this conversation. Myself, Richard, Brandt, and Alex on the initial observations on our telehealth survey. Welcome to another episode. We want to jump right into our topic today. And today we are talking about telehealth. Specifically, I thought it was interesting that Coker has been covering telehealth for literally years now. It's been something that's been on the radar for many for quite a while. However, it wasn't until earlier this year and really in the last 2 months that we actually, most people won't even know this, but we formed a task force specifically to kind of cover, monitor, and address telehealth and things related to that. And so this team here, folks that are on that task force in April, and as we're recording this, we're still in the midst of the COVID-19 pandemic. Also, telehealth is one of those things that had just absolutely historical levels of adoption compared to anything else in the past within the healthcare industry. When this really kicked off, one of the things we kind of said is, how are we going to address these needs for our clients? And the first thing we said was, well, we need to understand the needs better. Honestly, we need to understand what is really going on with telehealth when it comes to hospitals and health systems and medical groups and physician practices and other healthcare organizations. And so we thought we needed more information, quite frankly, because the nature of what has been happening over the last 2 to 3 months with this pandemic and the new normal that it is rapidly creating for the entire industry and for everyone, for the country and the world. We wanted to understand it better, what was meaningful for our clients and those that we interact with out in the industry. And so what we did was we developed a survey, and we wanted to conduct a study, which we did through a survey, went out in April. And specifically what we did was survey healthcare leaders, let's just say. Mostly these were executives, leaders, management level folks in both hospitals as well as physician practices, and all over the country, wide range of specialties represented, org types, things like that. But they are healthcare organizations that we wanted to get specific feedback from, and just to understand what is going on specifically right now with telehealth and what is meaningful for your organizations as it relates to this topic. Because we realize some things, honestly, they may be meaningful in the broad philosophical, theoretical discussion around telehealth, but for organizations and here now today, their needs may be limited, or some things may be more relevant than others. And while some elements of that just aren't as relevant right now. And so we wanted to identify that. And what we wanted to do today was basically just talk about some of our initial high-level findings. We are going to issue a report based on the findings of the survey. This wasn't intended to be a scientific, academic type study. We wanted to get real feedback from real folks that are out there on the ground. And that's what we did. And so really, we want to talk about the feedback, the general observations and takeaways. And we'll have follow-on podcasts and content that digs in deeper to some of these specific takeaways from the survey. But I just wanted Alex and Brandt and Richard to kind of give us some initial feedback. And maybe let's just start with some of the general introductions, takeaways of the survey. Alex, I may kick it over to you and just kind of kick us off on some of the high-level findings, and then we can drill down to some of the other points from there.
Yeah. One of the things that we were trying to understand is just provider perspectives, others that are in the healthcare industry. And as expected, it was nearly unanimous that everyone in the industry believes that telehealth will be essential to the delivery of healthcare moving forward. Nothing earth shattering there, but I think the implication or the recognition that patients are changing the way that they're consuming healthcare is the broader point to be aware of. In that these patients are now going to have an expectation as they get more used to telehealth of receiving care in this manner, which is going to really change practice patterns and an array of issues that we're seeing from the provider space. And I think, Brandt, you want to comment about how COVID is really driving that adoption of telehealth and serving as that tipping point?
Sure, thanks. And again, not surprising information here, but we asked the question and heard very clearly on telehealth being a permanent method for delivery of care. And then also 2/3 of the survey respondents indicated, as you might expect, that they were not participating in telehealth before COVID and have developed those capabilities since. And so as we think about the rapid deployment of a new care model, and there's so many different components to telehealth. It's not just a virtual video visit, although in and of itself, the virtual video visit and how that integrates with your existing operations is a more complex problem than simply having the ability to conduct a video conversation with a patient. And so anecdotally, to support this point, I think we've spoken with a lot of clients and providers delivery side that have either expanded on a dedicated telehealth platform, some that are integrated with EHRs, and or those that have just stood up Microsoft Teams or FaceTime so that they will have this capability and not be without. And I think as we look forward, post-pandemic, post-emergency situation, the question is going to be between these first two responses. If telehealth is permanent and 2/3 of us have just developed the capabilities essentially overnight, how do we make sure this is a sustainable operation for us, both economically and operationally? And right now, I think a lot of groups have focused on the operations, but when we get into some of the other questions around billing and coding and compliance and technology, I think there's a lot more to this than just simply standing it up.
Yeah, I think that's a great point. And, I was going back, I saw recently a statistic from someone released or made a comment out there that in 2018, adoption of telehealth, however you want to define that, was like 18%. which was probably even a little aggressive, again, depending on how you define adoption. And recently I saw numbers that adoption now post-COVID or in the midst of COVID is well above 50%. And, I think it's interesting that, again, in the healthcare industry, we've always been very slow to adopt, right? We've been talking about telehealth for years, and within, in many cases, a matter of days or certainly weeks or now just a couple months, true adoption has absolutely skyrocketed, and for obvious reasons. But I think that goes, to the point that it's here to stay. People are using this. People are embracing it, even not just kind of reluctantly accepting it, but truly embracing it and optimizing it. But I think, and Richard, maybe you can comment on this. I think it also brings up this whole adoption as a result or in response to shutdowns, social distancing, quarantine, et cetera, versus kind of the, let's just say, longer term considerations around, again, if it's here to stay, all right, what are some of the other variables there? So Richard, maybe if you want to comment on that kind of reactive adoption versus some of the long-term considerations that we found from the survey.
Yeah, Mark, thank you. I think, some of the results from the survey were pretty interesting. What we saw, and as we talked about, we had a large number of respondents that really addressed this or got into telemedicine as a result of COVID. So is COVID the quote unquote tipping point for telemedicine? And when we started digging into that a little bit, we recognized, or the respondents indicated that 60% are using, the Zooms, the Skypes, the FaceTimes. And we know that CMS provided a waiver for use of that inherently, and even in the language that CMS used, they were weighing the potential risks of infection for both patients and providers via their standard or historical way of looking at telemedicine. And at least from the Medicare perspective, telemedicine has a defined term, and there's limitations in terms of how they define telemedicine versus what we might describe more broadly as telehealth or virtual care. So we just want to keep that in mind. So we've got a number of those that presumably, we don't know if there's a strong correlation between those that are new to telemedicine as a result of COVID and the use of the Zooms and Skypes and FaceTimes. It seems logical that there would probably be a strong correlation between those. I think back to Brandt's point is when we look at telemedicine or telehealth, what are we really defining there? And it raises a question in terms of, is a longer term solution really in place? If we just take a quick trip down telehealth lane, so to speak, we've had the remote reads, we've had telestroke, monitoring of patients' ICU bunkers, we've added remote physiological monitoring, and then obviously when we're thinking primarily on the 60% that are using the Zoom, Skypes, FaceTimes, that's really the direct to consumer type care. Well, I think that begs the question in terms of, is that really the strategy that you want to play long term? The regulations that are there specifically relate to during the public health emergency or the PHE, but then more holistically, as providers have jumped in to be able to provide care in the immediacy of the situation, I think it's important to perhaps take a step back and say, operationally, even as Brandt was saying that they've led operationally to provide care, I think operationally longer term, what is this going to look like for the practice and what questions might that raise? There's a ton of opportunities that are there based upon that provider or practice's role in the market, the specialty, the types of visits that might be able to be used. Of course, where are we going to deal with reimbursement after this fact? Can you leverage technology? All of those things. I think there's plenty of opportunity there to consider. But even as we're dealing with COVID, let's hope that we're coming out of this relatively soon. What are the next questions that are there? And then I think the other piece is, as you're implementing either this temporary solution that you have, which is the integration in EHR, or a more longer term solution, when you have a chance to take a more comprehensive look in terms of what makes sense for my practice operationally in terms of how I care for patients, my role in the market. Is it necessary, and to what extent does that need to be integrated within the EHR? And I think in most cases, that's going to be the case. You're going to want to integrate EHR. In some rare circumstances, believe it or not, there's actually, for certain systems, not having to integrate in the EHR allows greater flexibility for application in that, for example, in that spoken hub model. But I think in most cases, in fact, from our survey, 70% of respondents recognized or believed that there was a need for integration in the EHR. So as you're looking at your long-term solution, as you're thinking about the application, the role in the market, those opportunities, I think it's important to understand the solution that you provide. What are you going to be able to do with that longer term, and then the implications for integration with EHR.
I think what we understood from the survey response is that organizations just had to get this rolled out, right? They had to respond to a pandemic. They had to be able to service their patients. And that was the first priority. And so some of these other items that are quote unquote on the back burner will have to be revisited in the near future, or as things start to stabilize, like compliance. We think that people recognize that it is a big issue that needs to be dealt with, but right now it's just about getting the platform launched and the ability to connect with patients. One of the questions that we asked was, what's your greatest challenge when it comes to telehealth? One of the options was compliance, and that was the lowest ranked response. I think operations workflow, how you're interacting with these patients, was the highest. But we did ask other questions as it pertains to compliance. Is your solution, your platform for telehealth, is that appropriately integrated within your compliance program? And nearly half either were unsure or said no, it was not. It acknowledged then in a subsequent question an array of compliance concerns that will have to be dealt with. Either, I think coding and documentation was a big one, as well as cybersecurity concerns, HIPAA concerns, these types of things that are on people's radars. But first and foremost, it's about being able to interact with patients, and then being aware of these things so that they can be dealt with as the fog clears. I think the same thing can be said for what Richard was saying on the IT integration piece and how it's going to fit within existing IT platforms. That's something that's going to be dealt with as practices are working to get patients rescheduled through their telehealth platforms and able to, understand how this fits into their day-to-day workflow.
Alex, I think you made a lot of great points there, and trying to get into the mind of a provider that is dealing with these types of entities. We've got a patient with a need. We've got to be there to meet that need. I think given even as we're dealing with the pandemic, let's look at this from the compliance perspective. We saw significant waivers on the part of regulatory authorities with regard to, hey, the context is almost, we're going to be very forgiving with what you're doing as long as it's related to responding to this public health emergency. And so I think from the perspective is, rightly so, providers are saying, hey, I was just trying to take care of patients. But, even in the midst of, as we're dealing with this, the rules are changing. For example, who can actually provide what service? Because as going back to a comment earlier, what's considered telehealth under the regulations and who can actually provide services. So I think even as we're dealing with this, even in this bubble, if you will, of time period of forgiveness or flexibility, shall we say, from regulatory authorities, I think there's still the requirement to stay up with what's allowed during this period and to know that may not always be the same. And so even the things especially from a compliance perspective that are perhaps not on the forefront of mind as we're dealing with patients, that will be, as those changes come, that will be heightened in regulators' minds. I think we're not to go too far afield, but we're not too far from some major significant regulatory investigations from telemedicine and kind of the DME scenario. So I think once we get past this, the tremendous opportunity is all the data, whether it be from cost, the level of care, a tremendous amount of data that we'll be able to take a look at and say, what did we learn and what can we do going forward? But I just can't help but think that those regulators are also going to think before we entered into this, some of the abuses that were taking place within telemedicine. So I think all of those components that folks are dealing with now are going to remain. They're going to look different, but we're also going to have an opportunity to address them more holistically, I think.
Yeah, that's a great point. We're clearly in the wild, wild west here of telehealth. And it wasn't like we slowly migrated that direction. We got thrust into it. So as you said, Alex, it's really no surprise that these organizations are first having to respond to the priority needs and issues. But I think it's interesting though. And again, Alex, you talked about some of the statistics from the study, but, it wasn't a high priority as far as the immediate needs. Compliance wasn't, but almost 40% that said there's concerns around coding and documentation. Well, Richard, that goes to your points about there will be outright fraud and abuse via in the whole telehealth dynamic, because there always is, right? But there's also going to be just a lot of things, let's just say, slipping through the cracks, frankly. So if coding and documentation isn't there, or there's still cybersecurity issues, privacy, and 21% indicated they have no compliance integration with their telehealth at all, which I think is actually a pretty high statistic for that particular point. So obviously these are things that are going to have to be addressed. The big question is, what is the time frame here? And of course, we would have to look into our crystal ball to really know what that is. But eventually, kind of, Richard, you alluded to this, eventually we are going to have to address these concerns. We can only kind of be existing in cowboy territory for so long and not kind of have risk for it. Would you agree?
I think it's going to be an absolute. There is going to be a period of temperance, if you will, related to this. But even just the nature and what CMS did in terms of allowing codes and circumstances to be billed, that there were particular regulations, whether that be everything from the number of times that a patient can be visited from application, supervision requirements along those lines. And so when we take all of these changes that were done temporarily, those will most likely come to an end. Hopefully not in their entirety, but come to an end. Quite frankly, shall I say, practice patterns that develop during this period of time that are quote unquote allowed or authorized, if you will, during this period of time. How will those change going forward? And as those changes come, we will have to make sure that, clients and our providers are addressing those. And I think that, historically, it'll be interesting to see, will CMS allow for, some, I guess, readoption back to the world, i.e., getting back into my car and actually driving every day, which I haven't done in a long time. Will CMS allow a transition, or will it be a hard close? And so in that scenario is the compliance and making sure you know what you're doing, how it impacts you. They're going to come knocking. So they need to be prepared from a compliance perspective. But I think the flip side of that is, down the road, with all the data that we have, with all of the experience that we have, I think this is going to allow a greater degree of virtual care than we've historically ever had.
No, I think that's right. I want to circle back here to someone made the comment or alluded to this, but one of the other things that we found was the need for integration with existing technology, infrastructure, and solutions. I think this is another example of one of those things that it may not be the greatest priority right in the midst of a crisis, but it's inevitable that we have to address this. And I think compliance actually ties into this. But I think to think about doing that, honestly, it could get really complex. And maybe talk about some of the feedback we got as it relates to integration with technology.
I think one of the responses was we asked how effectively your telehealth platform was integrated within your existing IT capabilities. And approximately 70% said that telehealth was either poorly integrated, somewhat integrated, or it was currently a standalone, but they plan to integrate it within existing technology platforms, which means that integration and interoperability will be a key priority in the future, especially in light of the previous points that were about how telehealth is here to stay. Richard, I think you were commenting about, or you were aware of the final rule on interoperability and how this may play into that.
Alex, I'll just say that without diving into that, I think that this is obviously interoperability has been something, going back to the initial challenges, of HIPAA across the board and the standards that are there. I think, there's interoperability. There is what we're seeing as applications with regard to APIs that can kind of sit on top of things. But whenever you're trying to implement those and really get it to the point of patient care, it raises all different levels of concern with regard to ability to meet patient need. And then, of course, security. The more you layer things in, the more you're trying to connect pieces. Obviously, you've got a higher level of security concern. So I think even as we're looking at this and the opportunity for telehealth, the opportunity to integrate the seamlessness by which and the efficiency by which integration, once it occurs, can benefit that patient care. I think there's a ton of questions or a ton of potential concerns to get it to the point where it's operating efficiently. And so much like everything else as we're talking about, that we are in this period where telehealth and virtual care is operating under a freedom of patient care and the immediacy of the situation. I think that's something else to think about as you're doing those integrations. The efficiency, the effectiveness, and then what are the risks and opportunities associated with that? And those are all questions that I think, again, part of this, for those that have jumped into telemedicine, or even those that haven't in some circumstances, haven't done it well, those are all opportunities to increase the efficiency of what you're doing to care for patients.
Yeah, and that actually kind of brings me to one of the other, I think, interesting points that came out of the survey responses. And, I think the technology is there. Again, I think with Zoom and Skype and FaceTime and Microsoft Teams, et cetera, the virtual interaction is probably right now is probably one of the easier things to address from an adoption standpoint. We've talked about compliance. We've talked about how eventually these things, these tools, these encounters are going to have to integrate with existing technology and data. But one of the other things is, and this goes back pre-COVID, right? The challenge, the pushback that the industry has always had with telehealth is, how are we going to get paid for it? How are we going to monetize it? How are we actually going to make this feasible, both clinically and economically? And pre-COVID, last year, the CMS already started to allow and extend the allowances for the reimbursement for these types of visits. And I think that's something we're only going to continue. But, and Brandt, I'd love for you to jump in on this, but billing, right? How does this factor into the actual billing process? So yes, okay, CMS is allowing it. There are codes out there that provide reimbursement for virtual visits and telehealth. And yes, the tools are out there. We can jump on Zoom, but how do we integrate and sync up the billing element to all this?
Yeah, great question, Mark, and good point. The COVID crisis drove a need to see patients, and which spurred many organizations out of a patient care perspective to develop these telehealth capabilities. But none of the things we're talking about are new capabilities. And the reason we haven't jumped in previously is not because it hasn't been as convenient for the patient, or we couldn't deliver care with this in this model. It's because we weren't going to get paid the same for it. And so this opened up from CMS, a lot of still evolving and developing billing opportunities. And so the thought that virtual visit would bring in as much revenue as a traditional in-person visit is really the groundbreaking impetus for providers saying, you know what, not only do I need to offer this capability at this time, if I get paid the same for it, then it's a whole new world of care delivery that was previously unattractive to me. there are a number of questions around the billing. And I mean, just this week, within the last few days, Richard put an article out actually to this point about RHCs and FQHCs and the new regulations around telehealth services in those environments that will really change their interest and ability in this regard. And so every day or week seems like a new release. And remember, this is all CMS. Many practices cannot survive on CMS rates across the board, and or health systems and hospitals and you name it, provider groups. And so there hasn't been enough time yet for commercial payers to finalize. CMS hasn't finalized. And so certainly commercial payers, which often take their lead from CMS, have not arrived at a final destination on billing for telehealth services. And so a lot of provider groups are capitalizing on the moment in which it's a revenue replacement play, right? We're not going to see these patients otherwise right now. And so if we can effectively bill the same amount as if we were seeing them, then instead of our patient revenue dropping by 40%, maybe it's only 20%, maybe it's only 15%, which is critical at a time like this. But to move forward, it's going to be less about replacing lost revenue and do we want to intentionally conduct these visits in a virtual environment or in a telehealth environment. And so many organizations recognize that the billing in our survey responded that billing was one of their primary areas of concern and focus, but over half thought that they weren't billing correctly. And that's just due to, I think, the newness and the confusion. And also, I think there's doubt about what sticks and what doesn't. So if you're not staying up to the moment on it, I think people are hesitant to overcommit to the longevity of these billing guidelines. And I don't blame them because I question that myself. As it impacts the rest of the operation, so outside of billing, we also asked about organizations and, wrestling with staffing models and the resource levels to support telehealth delivery. Obviously, again, we're in a vacuum right now with pandemic, but coming out of that, I think we're going to see a lot of organizations restructure the way they staff and or provide care, how they handle pre-visit prep and not prior auths and registration, and what goes into scheduling and where scheduling done. The majority of our respondents recognize that operations was the greatest telehealth challenge for them. And so at the end of the day, if you get the codes and you provide the documentation, you can bill. The billing rules may change and that brings uncertainty, but ultimately it's what is this going to do? If this sticks the way 95% of our respondents thought it will, and we continue to deliver care via telehealth, then how is that going to impact how many provider groups and health systems have run practices and care delivery for years and years? And how are we going to adjust? And so I think the big shift in my mind is right now we're doing it to replace revenue. What happens when this is a proactive strategy for us to grow our network? And it's not just about replacing what we were losing, but now we have an opportunity to expand our market footprint or provide care across state lines. We know some telehealth organizations are less about the technology and more about a virtual provider network. And so this idea that we could start really expanding and or shifting the traditional provider alignment models and what it means to have a patient network is going to impact not only the billing, but then how do you operate that? Do we really need these satellite clinic locations that we thought were critical before? If we can deliver care to these same patient populations virtually. And so there are a number of areas that's going to impact. And I think the billing is just the tip of the iceberg right now. And I don't want to forecast where it's all going to land because your guess is as good as mine. But I know that if we stick with this care model, there will be significant impacts to the way we staff for it and set up our clinic and provider infrastructures around it.
Brandt, I think especially as you deal with practice operations, on a daily basis, I think what's interesting is even way before the COVID pandemic, what we saw is in some of the telemedicine models, for example, subspecialists, as a subspecialist entered into telemedicine agreements and they're handling things virtually, they saw a reduction in average cost of those visits. And the thought being that some of the ancillary tests that if the patient was actually shifted over to the subspecialist might have been done, were no longer necessary. And so there raises some interesting questions about what's necessary for the quality of care, but also does entering into telemedicine potentially have a negative financial impact for some of those subspecialists? So I think even in all the things that you deal with on a regular basis, I think it's a question of, that there's a myriad of considerations and work patient paths through a practice and the implications that can be, pretty overwhelming. And so having a chance to kind of think through those collectively to help, quite frankly, guide providers through that would be a benefit, especially as we constantly see things changing. And so I think a couple of interesting things will come out of this is what kind of patterns will we see as a result of this? What kind of decisions might we make? Or whether it be the CMS or other payers that'll influence things. But I just think there's going to be so much, Brandt, in terms of what you deal with on a day-to-day basis and the opportunities that will be there for folks to really consider. And being quite frank, even as there may be an opportunity for growth, there may also be the adoption of telemedicine from a defensive strategy as some of your competitors are trying to implement those things. And I think in terms of, how do you actually help deal with that? And again, I think that's an opportunity to really dig into the operations to kind of set that up. So I think there's lots of questions coming down the pike, and how a practice staff operates there. It could look very different in the future. And I guess the point that I wanted to close on that section with is the way, and we know on the commercial side, so much of commercial reimbursement is based on Medicare. So if we look at potentially a fundamental shift in the resources, the way CMS actually creates or determines reimbursement, might we see some shifting with regard to staffing and indirect cost pools? And as a result, do we eventually see a different level of reimbursement for telemedicine than in-person visits? Not something I would suggest is going to happen immediately, but is that something that may come down the horizon? And does that further create a need to staff and operate things differently?
Yeah, good points, Richard. And our world in particular is going to be interesting. Those of us that do consulting for practices and operational delivery, just because we've had reliable and or trustworthy benchmarks and or perspectives for a long time, and this could put a lot of this in jeopardy and or bring new questions that make some of our preconceived notions about what's right and what's wrong and kind of flip them. And so we're doing a lot of work with provider groups that are in the trenches figuring this out today on what makes sense and this new frontier, so to speak. But ultimately, it's going to require some anecdotal and real world experience type perspective to help our clients in the future. And so I'll be curious to see as we come out of this, the difference by client type, client location, and the competitive market that impacts how we prioritize telehealth, how we deliver telehealth. If we're more focused on virtual visits, or is it remote patient monitoring? There are just so many different dynamics that could significantly shift the way we service our clients and those clients service their patients in delivering care. And so at the end of the day, yeah, we got to everyone's going to want to get paid for it and not be damaged economically, but how you accomplish that and for optimal patient care and optimal revenue could be very different for two practices that sit across the street from each other. And that's going to be, I think, a fun part of this, but it's also going to lead to some really tough decisions for practices that have thin margins and have thought about acquisition before and or may need to think about it now as a result of the financial damage from COVID. So much more to come on it, but I think from where we sit today, it can't be ignored anymore. And until now, that was a little bit the case. How that plays out for an individual system or group is going to be different, but ultimately there are a few boxes we know we need to check around operations, billing, compliance, technology. And I think helping groups do that is going to be a really fun part of our jobs for the next few years.
Yeah, no, I think that's a great point. And actually, one of the things you said, I probably should have made this point earlier, but we throw around the term telehealth or telemedicine, and the reality is it's very broad. There's a lot that you can kind of break that down into different things, different specific elements. You mentioned remote patient monitoring. That's something that we've dealt with here recently. And then it's not just the FaceTime encounter between a patient and a doctor on their phones. There's a lot to it. I think the interesting thing about the point around operations, and this ties to billing too, because that's definitely a component of that, is that in order to extrapolate over a period of time ROI from telehealth, the key, the most fundamental, critical point in all of this is going to be optimization, which isn't anything. I'm not saying anything, revolutionary there. But I think the key to optimization is the operationalization, if that's a word I can use, of telehealth into every component of operations. So we looked at personnel, changes in roles and responsibilities of different staffing models, I should say. We talked about the integration with technology, the billing piece. Yeah, it's maybe you can process a bill, you can code for an encounter, but are you really getting the full value from that? If telehealth is here to stay, which I think we all agree it is, then adoption has to be at kind of a different level than just kind of, we're doing virtual visits on our devices. And I think, again, as we said, it's only a matter of time until we kind of figure out, okay, we got to take this to the next level or kind of reach that next point in operationalizing telehealth at a real full level.
I was just going to comment, I latched on to your comment about, needing an ROI. I think it's going to be increasingly difficult to place that telehealth sole ROI because it's going to be ingrained in the practice operations. And the example that comes to my mind is thinking about how we moved from the floppy disk to the CD-ROM to the thumb drive to cloud storage. How do you place an ROI in any one of those? You have to evolve with the state of business, and it's the overall storage in that example. If you don't evolve, then your practice ROI will deteriorate. I think it's kind of the same thing in telehealth. Is patients are going to demand that there's new ways to consume care, and practices will have to respond with their patient access strategies to incorporate that in for the benefit of their overall practice ROI. So just an example that popped in my mind when you said that.
Well, I think that's a great example. And one of the things I was thinking about, I can't remember who alluded to this earlier, but if say you're a practice or you're part of a hospital network and you have satellite locations spread throughout, particularly in rural areas where we regularly see doctors that jump from one end of a state to the other end in a matter of a week, spending days in different locations. And if that's your setup and you're in you're a year from now find yourself doing more and more just routine visits virtually, and you can bill for those things, you kind of quote unquote optimize them to a certain level, then what's the cost structure? What's the cost value of still having those 4 or 5 satellite locations spread throughout multiple markets when you can maybe be able to reduce some of those costs and optimize some of the value elsewhere in telehealth? I think those types of things we see all over the place.
Richard, being our certified appraiser, he'll have more defined thoughts, I think, probably in future conversations about those valuation efforts.
That's exactly right. We haven't even touched on the impact of valuation when it comes to a telehealth world, but I know that will absolutely be another element that we're going to have to dig into. As we kind of bring this to a close, what I wanted to do is just kind of have each of you, and maybe we can go around the horn here, just kind of your quick thought key takeaway, key observation from some of the survey responses, or kind of a lasting thought as it relates to telehealth? Because obviously we will be drilling into these in more detail and subsequent content that Coker puts out. But Alex, maybe we'll start with you if you just want to kind of give us your general kind of takeaway and observation from what we found so far.
I think that everyone is in the telehealth space now, and patients are going to continue to demand it. And so practices have to incorporate it into their patient access strategy in order to be successful.
Richard, what about you?
I'll just say that I think, as they moved in, and we all know it's here to stay, that it's understanding that what we're dealing with now, to some degree, is going to be temporary. We need to stay vigilant about understanding where we are now, where we're going to be next month, and where we're going to be next year with regard to regulations, and really take a look at, strategically, what's the best options for us. And that includes everything from compliance, technology, and how we're operating those entities.
That's great. Brandt?
Yeah, I agree with those points. And I'd say, I'll go back to what I said earlier, that, telehealth's here to stay. Survey respondents agree, and there's no going back at this point. And I am most interested in seeing how we start to leverage it to enhance care as opposed to just backstopping the damage of the crisis. And so whether that's billing technology, operations, compliance, et cetera, this should be moving us forward as a healthcare nation. There will be winners and losers in that. And what's going to make a winner successful and what's going to cause others to miss out is going to be a tough road, but an interesting one that I think everyone is optimistic is the kind of change we need and the catalyst that could really propel things that we've been working on for years around value-based care and patient outcomes and consumerism and some of the other dynamics that we've discussed ad nauseum. So I'm excited to, as everyone is, to move past the pandemic mode and really start to see the fruits of what telehealth and the technology capabilities we have in delivering care now can bring.
Those are great points, all of you, and a great way to leave this, because as I said, there's a lot to unpack here. Honestly, we could spend an hour talking about just each one of these points, and these were just some of the ones we pulled out of the survey data and the feedback that we've gotten to just talk about and tee up at a high level here. So there will be, as I said, more information to come and more kind of digging into the details. Again, I think this was so interesting to just start getting a better, even if it's a snapshot in some areas, a better look into what is the real on the ground situation as it relates to telehealth. And then trying to now understand, and I think Brandt, you said we're just grazing the surface as far as what this is ultimately going to evolve into and look like here and some how much over time it takes. But I think we've only seen the beginning, and there will be a lot more. The next layer of depth that we have to get into, whether it is compliance or it is IT integration or it is operations and these other areas. So it'll be interesting to see. And I'm with you, Brandt. I definitely am looking forward to kind of getting out of the pandemic mode and really start seeing what this does in the future. But with that, we'll kind of stop this discussion there, and that way we'll have a number of things to pick up on in the next one. But thank you all for participating, and look forward to continuing the discussion here in the very near future.
We hope you enjoyed that episode of Coffee with Coker, and we thank you for listening. We want to encourage all of our listeners to participate and contribute in the podcast. So if you have any questions on any of the things we discussed in this episode, any of the topics that were presented, please feel free to ask us. Also, we welcome your feedback and suggestions. If you have any ideas related to the material we discussed in this episode, or in any episode, please let us know and we'll make sure to incorporate it. And if you have ideas for topics you'd like to hear more information about in future episodes, please send those suggestions to us. We would love to hear them, and we'd love to incorporate them into our future episodes. You can find us online and on social media. Start with our website, and specifically the podcast is coffeewithcoker.com. You can also find that through the main Coker website at cokergroup.com. You can also find us on social media, Twitter @Coker Group. And then on LinkedIn, you can search for Coker Group and find our page and the page for some of our team members as well there. So you can find us and reach out to us in a number of places. And then if you want to contact us directly, one of the best ways to do that, email feedback@cokergroup.com. That's feedback@cokergroup.com. And again, we'd love to get your feedback, and we'd love to encourage everyone to subscribe to the podcast so that you can be notified when future episodes are released. We look forward to the next episode, and we look forward to getting your suggestions and feedback on this episode. Thanks for listening, and we look forward to speaking with you again on future episodes.